All right, ready to dive into some seriously cutting-edge stuff? We're talking robotic surgery today.
Oh, yeah, this is exciting stuff, and the advances are happening so fast.
I know you're interested in the future medicine, and this is it. We're talking robots in the operating room, folks. Precision you wouldn't believe, but also some big questions about cost and who actually gets to benefit from all this.
It really makes you think, doesn't it? I mean, it's amazing how quickly robotic surgery has gone from like a sci-fi concept to something we're actually doing.
Right, and the level of precision they're achieving now. One article I was reading actually used the words enhanced precision, 3D high-definition imaging, and even greater dexterity. Sounds
Yeah.
pretty wild, right?
Oh, it is. I mean, just picture this. You've got these robotic arms, right? And they've got these incredibly fine instruments, way more precise than anything a human hand could manage. And the surgeon, they're right there, but they're controlling these arms from a console. They've got this magnified 3D view of everything. So it's like they're right inside the surgical field.
Wow. And this is being used for a whole range of procedures now, right?
Yeah.
Everything from prostate surgery to hysterectomies to even like weight loss surgery.
Yeah, you name it. It's becoming incredibly common. And the interesting thing is the benefits go way beyond just being less invasive. Like take prostatectomies, for example.
I was reading a bit about that, something about nerve preservation.
Exactly. That's one of the biggest advancements with the robotic approach. See, with traditional prostatectomies, there's always this risk of damaging the nerves surrounding the prostate. And that can lead to, well, some pretty significant quality of life issues for men afterward, like erectile dysfunction or problems controlling their bladder.
And with the robotic surgery, they're able to avoid that.
To a much greater extent, yes. They call it nerve-sparing surgery. The precision the robot provides allows surgeons to work around those nerves incredibly carefully. And studies have actually shown that patients who have robotic prostatectomies often recover much faster. Some even go home the next day, and they tend to have much better long-term outcomes, especially when it comes to, continence and sexual function.
Wow. So it's not just about the surgery itself, it's about the patient's life afterward. I mean, given the complexity and, like you said, this incredible level of precision involved here, the training to become a robotic surgeon must be intense.
Oh, absolutely. It's a whole other level of expertise. Surgeons who want to specialize in this, they go through these incredibly rigorous training programs. They spend hours and hours in simulations, basically honing their skills on virtual patients before they even step into an operating room.
Like flight simulators, but for surgeons.
Ex-
Mind-blowing when you think about how far we've come. But with all this talk about simulations and cutting-edge robots and stuff, I got to ask, what's the damage, like financially? This level of technology can't be cheap.
Yeah, that's the catch. It's not just about the skill of the surgeons, right? The systems themselves, the robots, they're incredibly expensive to develop, to buy. And then you've got maintenance and the training and even the instruments they use for each procedure. A lot of them are single use. It adds up really quickly.
So is this the kind of treatment that's only available to, like, the lucky few? I mean, how do we even begin to balance these medical marvels with making sure everyone can actually afford healthcare?
It's a huge question, and it's something that every healthcare provider is grappling with. There's a real ethical dilemma there. That being said, there is some promising research coming out about the long-term costs.
Oh, really? So it might not be as straightforward as it seems.
Right. Some studies are actually suggesting that robotic surgery might actually lead to cost savings down the line.
And that's interesting. How so?
Well, a few reasons. One of the biggest is recovery time. Robotic surgery is often much less invasive, so patients recover faster. That means shorter hospital stays, which obviously reduces costs. And because the procedures are so precise, you tend to see fewer complications. Fewer complications means fewer follow-up appointments, less need for additional interventions, all of that.
So it's kind of like looking at the big picture, weighing that initial really high cost against the potential for savings later on, and of course, factoring in the whole patient outcome side of things.
Exactly. It's a complex equation, no doubt. But it's a conversation that we need to be having, right? Because as amazing as this technology is, we have to find a way to make sure it benefits everyone, not just a select few. And that leads us to another fascinating aspect of this whole evolution, the role of artificial intelligence.
AI in surgery. Okay, now that really does sound like we're walking onto the set of a sci-fi movie. Are we talking like robots doing surgery on their own anytime soon?
Not quite autonomous surgeons just yet, no. But the speed at which AI is developing, who knows? Right now, it's more about AI acting as a super advanced assistant to the surgeon.
Okay, so what does that actually look like in the operating room? How is AI lending a hand, so to speak.
So picture this. Before the surgery even starts, you've got AI algorithms analyzing the patient's pre-op scans, suggesting the best incision points, maybe even flagging potential risks based on their medical history. It's like having the ultimate pre-op planning tool right at your fingertips.
So almost like AI is this second pair of eyes, helping the surgeon prep for the procedure with even more accuracy.
Exactly, and it doesn't stop there. During the actual surgery, AI can give the surgeon real-time guidance, analyzing their movements, even offering suggestions for improvement. Let's say there's sudden bleeding during the procedure, the AI might suggest a course of action, but the surgeon, they're the one with the real-time situational awareness, right? They have to assess, decide if the AI's suggestion makes sense given their own judgment, their experience.
Right, it's about both the human and artificial intelligence working together.
Mhm.
So it's not replacing the surgeon's skills or anything, more like enhancing them with AI's power. What about after surgery? Any role for AI in post-op?
Absolutely. Imagine AI analyzing recordings of this surgery, giving feedback on technique, helping surgeons to continuously learn and refine their skills. That kind of constant feedback loop could really raise the bar for surgical care across the board.
That's incredible when you think about the possibilities.
Yeah.
But it also makes you wonder, with all this incredible technology, how do we make sure surgeons don't lose those essential skills and instincts they develop over years of training?
That's the key, isn't it? As AI becomes more and more integrated into surgery, it's vital that we're not just training surgeons on how to use the technology, but also on how to maintain what we call situational awareness. They have to be able to recognize those moments when the AI suggestion might not be the best course of action, when to trust their gut, essentially, when to take control if things suddenly change.
Finding that balance, right? Using the power of AI to help people get better outcomes for patients, but not letting go of the human element, the surgeon's expertise and ability to make those split-second critical decisions.
Exactly. It's a fascinating field, and as with any major leap forward in medicine, we have to be mindful of the ethical implications. And of course, making sure these benefits are accessible to everyone.
It's amazing to think about. Robotic surgery isn't just changing how we perform surgeries, it's pushing us to rethink what it even means to be a surgeon in this age of AI.
Yeah.
It's definitely given us a lot to think about, that's for sure. Thanks for taking us on this deep dive. It was fascinating.